My name is Robert Toomey. I'm a board-certified podiatrist at Sentara Northern Virginia Medical Center. I work for a private practice, Potomac Podiatry Group. I am board-certified by the American Board of Foot and Ankle Surgeons, as well as the American Board of Podiatric Medicine. I'm a fellow of the American College of Foot and Ankle Surgeons and a fellow of the American College of Podiatric Medicine. For ankle arthroplasty, the procedure that's performed is typically an anterior or lateral incision. You're going down the level of bone very carefully, being sure to care for all vital neurovascular structures if you're going the anterior approach, and you're essentially placing a cut guide that's been pre-engineered via CT guidance to perform a minimal resection of cartilage and bone as possible. The implant's then placed within the bone, and over time the bone will grow into the implant itself. There's one component for the tibia, one component for the talus. Then there's usually a polyethylene plastic piece that goes within the central aspect of the device that helps allow for motion and gliding across this joint. They make jigs individually for each patient, and then we put them in place on the bone once we've done our dissection so that there's no loss in bone height, no loss in limb length. Advantages of ankle arthroplasty is returning to activity much sooner than with an arthrodesis. Typically, patients are able to bicycle, swim, golf, and other light leisurely activities in a period of 3 to 4 months. Improvements for the patient is less arthritis in the adjacent joints and less pain long-term, also shorter period of time of swelling because the bone is not chronically inflamed. The implants are lasting upwards of 10 years before any revision surgery is needed, and certainly the implant could last much longer. The literature supports 10-year survivorship at over 80%, approaching 90%. So in theory, we suspect that they should last a period of 20 to 25 years. Excellent ankle arthroplasty candidates would include patients who are active and relatively healthy with a BMI below 30. Weight is not a relative contraindication, but during the surgeries, we worry about wear out of the polyethylene sooner than later. Another relative contraindication used to be age. That's beginning to change. We do know we have to tell patients if we're going to perform these type of replacements under 60, 65 years of age that they may only last a period of 10 to 25 years and you may need to have a revision. The fortunate thing is there's excellent revisional systems down the road. Total ankle arthroplasty is not appropriate for the patient who's had a history of Charcot foot and or ankle. Any sort of neurodegenerative disease where there's significant loss of vestibular balance would not be ideal for the patient and or again neuropathy or loss of sensation to the foot. Diabetic is not a total contraindication, but we need to make sure that the patient's hemoglobin A1C is controlled below 7.2 to 7.3%. Typical recovery period is a total time of 11 to 14 months. The period of 11 to 14 months involves 6 months to 11 months of swelling. The patient's usually non-weight bearing for the first 6 weeks, but unlike an arthrodesis where they're in a cast, they're typically in a boot or a splint where they're allowed to perform range of motion activities day one. During the first 4 to 6 weeks, we will have the patient in physical therapy 2 to 3 times a week, performing range of motion activities and increasing their strength. Usually the patients have very minimal pain over the first 3 days. Days 3 to 7 is where they will see the rest of their pain, but they have enough pain medication to alleviate those types of pains. Often I'm in disbelief at how little pain they have. And so far through my experiences of total ankle arthroplasty, I've been very impressed with the outcomes for the patients versus an arthrodesis.